Come to order as the Board of Health. We have any members of the public present with us or online who would like to address the board? Hearing none, let's start with the minutes. Can I get a motion to approve?
So moved.
Any discussion? Get a second?
Second.
All in favor?
Aye.
Aye.
Opposed, same sign. We have a consent agenda item this morning. Provider for hospice services. A motion to approve.
So moved.
Second. Any discussion? All in favor?
Aye.
Opposed, same. John, you're up.
All right, quite a long one this morning, so I'll try to stick to the highlights. On Tuesday, October 15th, had the opportunity to have a one-on-one with Senator Baines and talk about the work we've been doing. Gave him an update on the mobile health unit and talked about some of the wins there. We've been able to expand access to care to almost 200 new patients so far. Pretty great opportunity. Had the opportunity to brief our county commissioners and the ag committee of the Chamber of Commerce earlier this month, and Tori was there, and kind of how this conversation started and got back to the senator. But we're able to talk about all the great stories we have in rural health across RiverStone and how expanded access on the bus has really helped, particularly in the area of behavioral. And we are seeing folks come into the mobile unit and feel more at home, feel more comfortable and confident seeing providers there when we come to them versus having to drive downtown and come into the medical office building or walk into the clinic that says behavioral health. So that's been a good win. And a couple other stories there that I was able to share. We talked about our work with Behavioral Health Community Work Group, and we'll save that to the end of today. We can talk about our work and efforts there, trying to get answers from the state. And we also introduced information on Kratom and what we are doing and trying to do to create a ban on 7-OH synthetic substance, which is a highly concentrated version of Kratom, and work to stop the sale of Kratom containing beverages in licensed food establishments across Yellowstone County. That effort in itself has caught the attention of the Kratom lobby and industry and some high-powered lawyers out of Boston the East Coast. And we will be responding to the lawyers soon with our interpretation. They tried to interpret Montana Food Code and we interpret for a living Montana Food Code. And so there's a disagreement, and we're going to agree to disagree so that we can protect our public. So Senator Daines was really keen on the education. He actually mentioned it in another meeting on Capitol Hill, I heard later in the week. So we did our job to educate. We were also able to tell him that, with your approval today as a board, we will be able to submit a down payment for the Colonial property and move towards closing on that facility sooner than later, hopefully by the end of the year. We talked about the need for any continuing resolution budget package to extend flexibilities for Medicare telehealth visits, but also to have retroactive reimbursement modality for the payment of claims that we are currently holding. We're continuing to see Medicare telehealth visits in the clinic, but we do not have the ability to get that payment from Medicare at this time. So we're going to continue to work there. And then we talked about HR1, the Rural Health Transformation Program, the 1115 waiver, and all the things that we've talked about here at the board before, as well as information on WIC and SNAP. And unfortunately, those funds run out at the end of this month. And so with 1 week left, we have an impact of about 2,500 WIC patients. And about half of those are SNAP recipients as well. And so we shared that messaging with our Senate leadership, and they said that there should be some tariff revenues coming to the states. Hopefully they come in the next week. But I also then read an article later that week that the administration is having difficulty breaking the tariff piggy bank open to distribute those funds. So to be determined, but our work will not stop. We'll be able to continue helping folks here locally. There's also going to be a large community food drive effort to help collect some foodstuffs so that folks don't have to go without. But more on that. So that was a great meeting. Talk about all of the things impacting RiverStone Health and the region. We're doing lead inspections again. If your house is built before 1978, you should get your paint checked. So if we're doing some blood tests for kids here on campus, and we'll share information about that. But on October 23rd, folks can come here from 1 to 4:30 and get free lead testing. We had a great open house down at Warden, up at Warden on October 3rd. And then I wanted to share the update November 13th. Save the date, please. If you're interested in coming to campus, we'll be lighting our tree and celebrating our hospice tree of lights. And Steve, you got your hand up? Question?
Yeah, going back to Dane's, what's his prognosis on where we are and the impasse and the impact that the ACA will have? What, I mean, did he share with you outside of the Republican response, just what he thinks is going to happen and potentially when?
So he had to jump conveniently as I was getting to that part of my agenda to a phone call with the White House. But I did stay on with Matt May, his healthcare advisor. And Matt did say, so that was Tuesday or so, Matt was talking about some fissures happening within the caucus and conversations around the tax credits and them getting over themselves from sharing the misnomer and the lie that illegals are getting health care. And we talked a little bit more about that in depth, and he said there are things starting to happen on the subsidy front and the ACA. And then recently this week, I started reading in Politico and elsewhere that there are behind the scenes conversations happening about that issue and what it could do to certain swing candidates during the midterms. And it would be a death sentence to certain candidates out there across the country. So now they're coming more apt potentially to come to the table.
Okay. I more curious, and I know it's way too early because I was just looking at budget, the impact that would, I mean, figure the worst case scenario and the potential impact on the budget that we have. It would, I'm assuming this would be a fairly significant hit to us.
Yeah, it's some of that HR1 conversation we've been having, trying to plan for the worst and hope for the best and figure out what this is all going to look like. But it's going to shift to Medicaid. It's going to shift to uncompensated care, and the American people are going to end up paying for it anyway.
Right. Okay. I appreciate it. Sorry to interrupt you.
No, thanks. So Hospice Tree Lights, November 13th, 5 p.m. Please feel free to join us. And if you've had a cup of coffee recently around the community, you might have gotten a pink sleeve talking about Montana's cancer control programs for breast cancer awareness. So that was good partnership between public health and our local coffee shops. Also had the opportunity to go out to Bridger earlier this month and talk about HR1, talk about our rural clinics down in Carbon County, and meet some folks. And that was a good opportunity. Provided that HR1 presentation that I gave to the board last month to that group down there for their education. As we get to Halloween next week, I've got a kid with a food allergy. I don't know if anybody else does, but the Teal Pumpkin Project is something you should take a look at. If you want to provide something other than candy or food, stickers, temporary tattoos, small toys, the Teal Pumpkin Project is out there, and it will provide an interactive map of homes around our communities that are participating and have things available for kiddos with food allergies. The Behavioral Health Community Working Group again met on October 7th to talk gap analysis and talk system. Meeting to say, hey, here are some of the weaknesses and gaps we have in our behavioral health system, and try to move things forward wherever they figure out and whatever they do with the forensic behavioral health facility.
I think it's more accurate to say we talk, they should not listen.
That's fair. So the community providers talked, and we will continue to talk. And so our next meeting next month, I've already had this conversation with legislators, is going to be more focused on community providers generating solutions for community providers, because that's where we need the momentum and to continue the group. And I'll share notes in new business later on in the meeting, and we could talk through some of the more specifics and some of the latest updates we have on the potential facility. We will be getting our check next week, 2 weeks, November 3rd from Cushing Terrell, which is great, and it's going to benefit our Kid Connect programs. We have 3, potentially 4 candidates for our chief people officer position, our senior executive in charge of HR. And we will be doing those interviews next week. Michael.
Quick question. Just curious, the name change for that position, where did that come from?
Yeah, we had a conversation with senior leadership, and so what are we looking for? What do we want out of a leader in HR? And one of the things that we've strived or hold our hats on at RiverStone Health is taking care of our people and having a good, strong culture, whether it's through our organizational culture team efforts, or when we look at employee engagement or low employee turnover, and trying to hone in and be that, employer of choice, if you will. And so instead of a CHRO or a chief human resources person or VP of HR, we said it's really people management, and it's recruitment, it's retention, it's working through how do we take better care of our people. And so there's a definition out there on what a chief people officer is versus what a VP of HR, what a CHRO is. And we all came to the conclusion that we want a people person.
Okay, I should have Googled it. I didn't think of that at the time. Number 2, do we still track turnover rates?
We do.
Did we see the board see some updated numbers sometime?
Yes, you can. Yes, you can. I was supposed to put them in my report this month, and I didn't. So thank you for the reminder.
Next month.
Yep.
Thank you.
But it's still very good.
Good.
Yes. So we'll be working through that and have made that switch to Chief People Officer. As well as working through some additional transparencies in our hiring process. This week was payroll week, and we did a little urgent systems redesign and a quick Kaizen using our Lean Six Sigma tools to look at breakdowns in our payroll process. And we have a very manual, tedious process in which systems, UKG, which is Ultimate Kronos Group, our HR IT system, for other things that help us more accurately process and more efficiently process payroll. Steve. Let your hand go up again. Oh, you're muted.
That's his question.
Okay. So John, can you go back and talk when you were talking about the HR individual? There's something in your report that talks about transparency and that the staff was against it. And could you explain? I read that. It was sort of like, wow, that was unusual coming from this organization. So I don't know what it really meant. So
we have a problem. Leadership is working to fix that problem. Even though we have good people processes and leaders in place across the organization, our prior leadership team in HR, the VP and senior director that left us after creating a very insular, a very isolated, and a very closed off black and white HR department. And they never empowered leaders across the organization to have the knowledge of HR processes, to coach their people effectively, to manage their performance. They just took it and did it. And they never managed out of that HR department. And so we are cleaning up a negative culture in that particular department that needs some skills. And so part of that effort is to create additional transparency. Part of that is to help managers understand where their folks are in the recruitment process. And we're going to be doing a series of in-services to help better empower our managers to understand what HR's role is, what their role is in human resources and managing and leading people, and taking us to a new level of work together. So that's that in a nutshell.
okay, thank you. That explains it very, very well.
Thanks. So every time there's turnover, there's good time for change.
Absolutely.
So we have our holiday bazaar coming up too. So November 7th, save the date. If you're a maker or a creator and you want to sell your wares here, we will be hosting our holiday bazaar. All of those proceeds benefit our Rocket Culture efforts, as well as our holiday care program for children in need this holiday season. And so feel free to stop by and check out what's being sold. Within public health, we have seen calendar week 40 come and go. Calendar week 40 is traditionally the start of influenza season. And we have continued to have problems with getting data and information out of federal systems, and particularly the CDC. 2 weeks ago, the entire MMWR data team at CDC was let go. And a few hours later, they were rehired because of a clerical mistake in their furlough. And so there have been plenty of ups and downs within the CDC, and there is little data to show for the chaos that's been created down there in Atlanta and across the country. So while we don't have any good data from CDC, we have plenty of great data from the Yale School of Public Health, from Johns Hopkins, from other entities and agencies who've stepped in to fill the void. And we do have some flu data from a national respiratory and enteric virus surveillance system. With that, we are entering flu season. You will all have the opportunity to receive your flu shot should you want one at the end of the meeting today. And so we'll do that for you with our immune staff. And then we also had a Q2 interview with Dr. Littlefield and Dr. Koo from Billings Clinic talking about measles. And I talked to comms and they said, oh, they want to do an interview about the new measles outbreak. And I said, what new measles outbreak? Because we don't have that data and those reports coming to us. We would get an alert from CDC or someone else saying, hey, there's an issue y'all need to be aware of. And so I went out, did a quick search on Yale School of Public Health, and they've got a great new sit rep on the large measles outbreak in Utah and Arizona that is currently ongoing in the Southwest. And so there are 44 plus cases in Utah and 52 down in Arizona. And yes, you read that correctly when you see MMR vaccination rates in certain locations in Arizona are down to 7% in certain insular populations. And so they have a growing problem down there that we're keeping an eye on just in case folks travel. That's what we know about measles right now. It's, again, the highest in 30 years nationally with over 1,500 cases. And unfortunately, it continues to grow. There was some conversation over the MMR vaccine and whether or not it should be split up or not, or what the conversation should be. But my goodness, even if we wanted to split MMR up, we couldn't. Because there's so much more research, testing, and manufacturing that would need to take place. It's just not realistic. And there is nothing wrong with the MMR vaccine. We continue to work, I said, with Kratom, and so I've put language in my report on our letter that will be still going out to licensed food establishments shortly. County attorney, city attorney, county attorneys asked us to pause and take a look, as well as city attorneys. So we're going to be getting with them based off the legalese document that was sent our way from the Kratom industry, and making sure that we're all on the same page for how we interpret Montana food codes, that we take care of our people. So far this year, 29, I think now 30 confirmed deaths due to kratom overdose across the state of Montana. Sorry, since 2020, not this year, since 2020. So this has become a growing problem, and we've got to do something about it.
Where's the resistance coming from?
Primarily the industry. There is a civil war happening within the kratom industry. And it is between the 7-OH synthetic folks that are making highly concentrated shots that you could go down and get at the corner store or the vape shop, versus the natural leaf folks that are saying our product is safe, it won't cause addiction, there's no issue for harm and misuse. And so there's the natural folks and the synthetic folks, and they are fighting to see who comes out on top. And so the kratom industry is saying, Yeah, we want to be regulating Jan 7OH, take them out so that they remain the lone man on the totem pole. But it's still not good, and it still can't be sold. It can't be marketed legally across the U.S. as a dietary supplement, but they are. And it shouldn't be sold in food establishments because it is not a generally recognized as safe substance. And therefore, if it is in a food product, such as a beverage, that food product or beverage is considered adulterated. The same way that you can't go down to Wendy's and get a marijuana burger because that would be adulterated. And so they are fighting, saying, no, it's dietary supplement, it's an herbal, natural thing, and we should be allowed to sling it wherever we want.
And the resistance locally is particular establishments?
It's a moneymaker. It's caught on, it's very popular. And so businesses are doing business, and they found a product that is popular with local clientele. And so it's a moneymaker. And we're trying to help them understand what the risks are to the community, what the damage is to human lives that are being ruined by a new catchy drug. All this is a new drug that is filling a void for folks that have substance use issues and addiction. And we need to get to the root cause of the substance use and addiction instead of trying to provide them with a new catchy substance.
This is the recreational marijuana discussion all over again, with all of it.
Yep. So as we celebrate 20 years of the Clean Indoor Air Act in Montana and our small victories over the tobacco lobby and industry, we now find ourselves facing a new lobby and a new industry. And there will be another new lobby and a new industry. But it's really interesting. The FDA, the Trump administration is going heavy on the 7OH synthetic stuff. And if you listen to the FDA Commissioner, Dr. McCary and Dr. Oz and others, they are parroting the kratom industry. We're not targeting natural leaf. It's okay. It's okay to use, except the FDA already says it's not, and that it's not safe. And so we need to do more research. We need to figure out how to keep folks safe and move us forward.
Where does the name 7OH come from?
So it is so there are two mainly active and addictive chemical compounds in kratom. And the first one is metrogene, and the second one is 7-hydroxymetrogene. And it's the 7OH is the shorthand for that. And so what they're doing is they're isolating the 7O and concentrating that into gummies, powders, etc. Yeah. And it's an opiate. It's effectively an opiate. It's a opiate antagonist in the physiology of the human body. And so you need Narcan to reverse the overdose, and it is highly addictive. So we're going to continue working on this, and the state is working potentially in December to emergency schedule 7OH as a Schedule 1 substance, which would effectively ban it from being sold in the stores and available to anyone. But we will be taking action on both natural leaf and 7OH within our authority to regulate licensed food establishments. It doesn't mean that RiverStone Health is banning kratom. It means that we're limiting its sale in licensed food establishments where we'll have authority. I asked the clinic board this earlier this week. I wanted to ask you all. The goal would be at our annual board meeting in January or we have our board's dinner, save the date for Tuesday, January 20th. Tuesday, January 20th at 6 p.m. We'll have our board dinner. But would you be open to having Narcan training as the board education at that meeting?
Definitely.
All right, absolutely and definitely. The ayes have it. So we'll be organizing Narcan training for our board education.
And that's January 20th.
And that is January 20th at 6 p.m.
And will that include being able to figure out when to use it?
Yes. Yeah. So we'll go through that. I'm going to wrap up my report here. We talked through the most important parts of kratom, and we talked about overdose. Finally, we did talk about then 20 years of the Clean Indoor Air Act. And so I just wanted to take a minute and recognize. Hey, Brent. 20 years ago, we began having smoke-free restaurants and bars. Thank you. Other questions?
Any other questions or comments, John? Go.
You know, the stuff on the mobile unit was fabulous. Is it profitable? Or, I mean, is it covering its costs?
Is that in our finance report, this?
I can speak to it for a second.
Yeah.
It's just about covering itself. So we still have funds available from the Important Family Foundation to help supplement that as we get it up and going. Really just using that for staff time, but through the month of August, starting your break even.
And then finally, before I stop, the other two important dates to remember. There's no Board of Health meeting next month in November. Happy Thanksgiving. And we will meet again on Thursday, December 4th. Same time, same place. So Thursday, December 4th will be our next Board of Health meeting. Thanks.
Okay, any other comments or questions for John? Megan's not with us this morning, but she's given us a report. Any questions or comments about Megan's report? Hearing none. Why?
I was going to ask, how do we go about a curriculum for the APP residency?
So they're basically have the infrastructure built with the family residency program. And so it's a copy paste essentially into the APP residency for building out rotations, talking through didactics. What do we need to cover within that year program?
It sounds like a great program.
They attend all of the same didactic lectures and activities. Rotate through various clinics.
And then there was something about expanding services that they provide. And I was just wondering what they were thinking of.
Oh, expand what APPs are providing?
No, I think the whole thing.
Got it.
Forget that.
Sorry, I'll follow up with you.
Anything else? Lionel, Safety and Quality Committee.
Safety and Quality Committee. And two topics that we discussed that were presented. One was had to do with our ethics committee, and yes, we have an ethics committee at RiverStone. Some of us have lots of experience with ethics committee. yet. So it was a good sort of back and forth discussion. He suggested that they formalize that ethics process maybe a bit more to, you know, base it on ethical principles, of, you know, benevolent, non-malfeasance, and all those that typically ethics committees use to make decisions in a formal way. And then the second item was on how we use customer feedback to improve services that we deliver. They're taking steps to automate that process. It can be. And they look at things like, I mean, everything having to do with the patient experience, from wait times to time alone in the room to, you know, how long it takes to from when you come in to when you're taking all these kinds of things that impact the patient experience. And by looking at them, that's how you can improve them. So that's what they're doing. Basically, it.
So in ethics, is there a institution-wide form that we have our employees sign?
I don't know that.
So we have our standards of behavior that is similar, that is talking about integrity and service, all those are core values. And that's signed annually.
I was just thinking, if you want to elevate the ethics issue, I mean, I think the simplest way is to have a form just like that one there that everybody's required to sign, and you know, it's just that they acknowledge that they should act ethically.
So I think,
Just for what it's worth.
yeah, so I think a lot of what ethics committees get involved with are questions where things are ambiguous as to how you treat a particular, usually involve patients, and there may be a question about, I mean, we could do this or we could do that, and yet neither one seems like, you know, how do you make that decision? I think that's what the ethics committee gets more involved with, as opposed to, you know, if your behavior is not up to our standard, that's kind of a different issue altogether. That's an HR issue. That's a public issue. So,
So I know in the ethics report, there was a small spelling error. It said tenants instead of tenants.
would be tenants. Yeah.
Yeah. Started trying to figure that out, then I realized.
Not renting ethics.
Approach.
And your expansion question, Coach, was related to expanding the number of students we can take in behavioral health.
Okay.
And so we're trying to take on more licensed candidates for social work and pre-behavioral health studies so that we can expand that.
General comment for the board. Since the last, year or two that we've had new committee leaders from staff leaders and different format for what that committee is doing. And we've had overwhelming volume of information and data. Bottom line to me is how impressive it is to see the staff aggressively working on how to improve what they're doing, making things more efficient, saving money. It's really a compliment to the entire staff of how aggressive they are at making improvements in quality. And yes, we address safety as well, but they sort of go together, and it's quite impressive. Thank you.
Other comments? Hearing none, let's move to public health. Brent, are you with us out there?
I am. Can you hear me?
Yes, we can hear you well.
I'm doing okay. Yeah, we did not meet this month.
Ready? Time for finance, Spencer.
All right, well, I'm excited to, we're gonna change up the format of this presentation just slightly. And that is that Shannon and I are gonna tag team on this. We'll try this out for a few months with the idea that Shannon's like the experienced professional here and I'm the board. So you'll notice that at the end of the financial presentation, there are some key performance indicators that I will talk about. But we'll let Shannon take over and just talk about the historical performance of the organization.
Good morning, everyone. So included in the packet this month are the August 2025 financials. I'm just going to comment on a couple things on the balance sheet and the statement of revenue and expenditures before Spencer gets into the dashboard information that we've got included within the packet this month. For the end of August, cash balances total about $13 million. If we're looking at a comparison of where we were in August of last year, it's an increase of about $5 million. Of this balance, about $10 million of that is unrestricted. The days cash on hand at the end of August were at about 64.5 days. It's a little bit of a decrease from where we were at in July and June, but that's normal cyclicality for us. And so nothing to be alarmed of within that. I'm still tracking to hopefully meet our goal of 84 days by the end of this fiscal year for days cash on hand. At the end of August, deferred revenue is about $2.3 million. We still have about $711,000 of COVID funding that we'll continue to use as we finish our payments for the mobile unit bus barn addition and as well as the mobile unit lease. And so all of that is earmarked and just working through spending that remaining balance this fiscal year. We did recognize about $277,000 in COVID funds this month, and that is really just related to the bus barn addition. And so that will be a variance that we'll see within the financial statements, obviously impacts the bottom line for August and also impacts the fixed asset additions for the month of August. Our grant drawdown process does remain up to date. We're still continuing to receive all of our grant funding. I'm able to draw through our PMS site for our federal grants, haven't had any lulls in any of that grant money. And we're also receiving our Medicaid, Medicare payments as of now. So we haven't seen any lull in that. We did have a little bit of a lull in our payments from the hospitals as it relates to our MFMR contracts, but we're back on track with that. Just appeared to be a little bit of a blip, but receiving those payments now. And so everything's back on track as it relates to the grants and the contracts receivable. On the statement of revenue and expenditures, the patient services revenue was a little bit under budget for the month, about $210,000 under budget. Bulk of this variance is related to Medicaid and bulk of this variance was in the main clinic. As I mentioned, our contracts and grants revenue is over budget for the month, and the majority of that is due to the COVID funding that I just discussed. We recognized $277,000 in COVID funding in the month of August, and we're $273,000 over budget in that. So that's pretty much the entire variance in the contracts and grants revenue. And then on the expense side, wages and benefits would continue to be under budget in that. For the month of August, about $319,000 under budget. We're running about 34 FTEs under budget, which is really consistent with where we were in July. So about the same mark as we were in July for FTEs. And then, so for the bottom line for August, the financials represent net revenue of about $528,000 compared to a budget of about $276,000. The bulk of this variance, as I discussed, is related to the COVID funding that we recognized. And then on the expense side, the variance that we're seeing in salary and benefits.
Any questions before we get into these key performance indicators? So before we get into this, before I present these are, if you, they look like this. So I don't know if that is, if you're looking at the forms electronically, let's see, that's page 35. And the first thing I want to say is because there was some concern that the color red might cause some panic among some of our experienced board members. Yep, one of the names mentioned. I don't want you to don't panic. Mostly we're just showing that in some cases we've established a goal, and whether it's above the goal or below the goal, it would be red or green. And so just don't panic about that. That's a goal that we've set. It's a long-term goal. That's going to look red for a while. So we don't want you to think that that is a problem necessarily. So the next thing I wanted to say is that we followed General Patton's credo, which is in the implementation of these, which is a good plan executed violently today is better than a great plan next week. So with the idea that these key performance indicators might change and modify over time as we get better data or get better at what we're doing, or even on a month-to-month basis where we want to talk about or discuss a specific area of the organization. So with that said, we'll talk about some of these that we've chosen to start with, and hopefully this information is helpful to you. Some of us, I think, are better absorbing information graphically rather than kind of the green shade bean counter approach that others are. So we'll start with the day's cash on hand. You can see that up in the upper left-hand corner, 64, like Shan mentioned earlier, 64.48. What the graph also provides, you'll see in the background there, a nice shadow of the historical measure. So you can kind of see that little mountain range behind us, where we've been over the last, I think, this 3 years. So you can see a market improvement over the last 3 years, but you'll be able to chart those on each of the graphs that on the top of the page. Each of those will show a 3-year history of where we've been and where we are today. We talked about the net revenue already. You can see our performance there is above budget. And then the third item there is days in AR. So this is, I think, an important measure. It shows how efficiently the organization's running in terms of collecting receivables. So you can see a dramatic improvement over the last 3 years in that area as well. So any questions on those first 3 measures? So, like I said, part of the reason of picking some of these measures is to drive conversation and to drive focus a little bit better than a natural or a historical financial statement has been able to provide for us. And I think it's best illustrated in these next 2 graphs that are included. These are essentially the same graph. One is presented on a monthly basis. The other is on a year-to-date basis. But this is our net revenues by service line. So one of the things on finance that we've been talking a little bit about is sometimes when we're talking about the financial statement, we can get lost where some of our big drivers of revenue really are. And so you can see here, at least on a monthly basis, the big driver of net revenue was the public health services area, and then followed by the 340B pharmacy, and then so on. So this hopefully gives us a little bit idea of from a revenue standpoint, the money's coming in. And now, obviously, we have a lot of areas that we're not driven by revenue here. We're driven by purpose, and so it doesn't necessarily rank those in order of importance, but it does give you a general idea of, at the end of the day, ultimately these graphs should kind of even out. So you can see both, like I said, the top line and then the year to date. You can see on a year to date basis that the revenue from our 340B pharmacy remains an important component of the bank's overall financial health.
Steve's got a question.
Steve?
Yeah, I'm sorry, Spencer, to go back. Let me make sure I'm not on mute. Shanna, this is actually for you. Going back to the payroll and wages, where you're roughly $319,000 under budget. You said you were 30 FTEs below. I'm just curious and hypothetical. If those 30 FTEs were hired, what would be the impact on revenues? In other words, would they go up? Those 30 would generate another $1 million, and making up numbers. And I know it's a hypothetical number, but you've got the FTEs. I mean, there's
Yeah.
a certain amount that's great that we're below, but at the same time, it's costing us is money. And I understand about the hiring and all of the other problems associated. I'm just more curious of what that impact is to us.
Yeah, that's a great question. And so a lot of the vacancies that we're having right now are mainly support staff, which obviously aren't directly revenue generating, but they are indirectly. And so a lot of the issues that we faced over the last couple of months have to do with the medical assistants within the clinic. And so not having enough staffing within those positions obviously impacts the provider productivity. And so it is a trickle effect. And so like I said, most of those positions aren't directly patient generating, revenue generating. They are very impactful in that. And so I don't have an exact dollar amount for you, but yes, we're under budget in expense because of this, but we're also under budget in revenue because we don't have the staffing to get to those levels.
Okay. Thank you. Sorry, Spencer, for interrupting.
No, it's a great question. And for the board and everybody's awareness, we've now, we've hired 13 MAs over the past almost 6 months. And so we've gotten back up to neutral, and we have had an onboarding this week actually, and hired another, brought in another 4 or 5 MAs. And on Monday, we were fully staffed with MAs. On Tuesday, we got a resignation, and so we dropped one again. So it's a never-ending cycle, unfortunately. But we've closed that gap tremendously, and we also have MAs in waiting, so to speak, candidates that are on the hook for when we do have that. So we were able to actually backfill that immediate vacancy right away, because we had somebody lined up.
So how long do our MAs last?
That's a good question.
As long as a typical MA lasts.
Yeah.
So we have some MAs that have been here for 10, 15, 20 years. It's not a very longevity type position for most people, because they're working towards their LPN or they're working towards an RN. But we're Dustin and HR are working to get some turnover status specific to key positions. And I think that'll be included next month.
Any other comments or questions about the finance committee?
Like my question, it helps me a lot, the explanation of it.
And Michael, I asked for yellow. We do 2 colors.
It wasn't so much the red. The red caught my eye, but then there's an exclamation point after it. That changed the. This is bad.
That is good. That's a good point. We'll take that under consideration.
So in the finance committee, we had a lengthy discussion about these. We had pages of graphs to choose from, and we tried to pick the graphs we thought showed, the trends of where the RiverStone owns. And so if you guys look at these and you decide this isn't what you want, we can go back and look at other things. But we thought these were the best.
Helped me a lot.
Yeah, exactly. And really, we're trying to drive conversation and strategy and discussion and so that's really what hopefully this helps provide. And so.
Anything else? Can I get a motion to accept the meeting?
So moved.
Second.
All in favor?
I
Opposed? And motion to accept the financial statement.
so moved.
Second. Can I just add one last thing? Ken and Tyler did a great job. On page 37 of your packet, there is a list of all the terminology. So if you look at any of those graphs and you're trying to figure out why that's included or what's it for, they've done a great job articulating what we're trying to achieve with each of those graphs.
Thank you. So all in favor of accepting the financial statements, signify by saying aye, please.
Aye.
I'm gonna pull ball back to safety and quality. I think I forgot. Let's go accept those meeting notes. Can I have a motion to do so?
Second.
One favor?
Aye.
Thank you. Any old business to come before the board this morning? Hearing none, let's talk new business. In your packet is a resolution for YHP. YHP board met and has agreed that we would like to purchase the building on the corner,
Buildings.
the Colonial,
Yes, the three buildings.
Three buildings.
three buildings, excuse me, yes, the property on the corner, the Colonial and two other buildings.
Outbuildings.
There you go. Move approval.
Second.
Aye.
Any discussion?
Are there other buyers interested, or and are the trustees with us on our desire to take this over and do it right?
Yes. I became aware of another potential buyer yesterday, but they were not a serious bidder. They were, so they weren't even in consideration. So we will fully execute the buy-sell agreement and deposit the money this afternoon. And we will be the sole purchaser of the property. The proud owners of new property on the south side of the tracks.
So after taking down the building, what are our plans for the area?
To make an undesirable space until we can make a desirable one. So what I don't want to happen is we build a beautiful park on the corner. And it becomes a green space the community loves and doesn't want to get rid of. Because ultimately the plans are for a center, a South Side Resiliency Center of some shape or form. One primary goal would be to replace our current dental clinic, which is in not proper order. It keeps having physical space challenges. And so we need additional dental space capacity. And so that'd be one move down the street. There's the potential then for the possibility to drive through pharmacy and additional access to pharmacy services. But the primary purpose of the building would be to have services on the first floor, whatever those may be, whatever we determine the community need to be. Maybe even a community grocery store, food service, something that this community does not currently have and needs. And then build up and try to build in 5 more, whatever we can fund at the time. Permanent supportive housing, a graduated model, something that supports this community and gives back.
So you can make it a temporary parking lot.
Yes.
I would say, yeah, well, you have your heavy equipment there, just make a pad. So whatever you decide to do, you're one step up on it.
Yeah.
Hey, John,
Yeah.
regarding the purchase, I guess the question from a liability standpoint is how the sale goes through on whatever date. The ability to either close that off or mitigate anybody from getting in there. Is that, I mean, I could see us buying it. I could see us, even over a weekend, what could transpire there if we don't have it roped off, somehow fenced off, mitigated or something. We leave ourselves wide open, which I'm assuming somebody has thought of, but I just figured I'd ask.
Yes, sir. We've been conversations with the city, conversations with the family. Right now, the eviction notifications process has begun. There are folks in there currently without leases, technically squatting. All of those folks have been notified that they're due to be evicted and removed from the premises. And so that process is ongoing. That's up to the family and the estate at the moment to make sure that those evictions happen expeditiously by court order. And so we're working, supporting, trying to help. We continue to try to support the folks that are in there, find other housing options and opportunities. And the goal would be to ensure that everybody is out there by the date of closing, which right now is December 1st. And once everybody is out and we've confirmed that, if we close at 1:30 on December 1st, there's a demo crew there at 1:35 doing its thing to make sure that it can no longer be habitated.
Okay. Say another question.
Excuse me, question about the legal process. Evictions are not fast, and I'm guessing that those folks are not going to be easy to serve. So what is the likelihood, do you think, of the December 1st of actually being out and having those court orders in hand?
Don't know.
Okay.
Yeah, that process has started already. So, yeah, I don't know.
So typically it takes about 90 to 120 days for an eviction to go through with people who you can find.
Yeah.
Will closing be delayed if they're not out, or does it become RiverStone's problem?
Closing will be delayed.
Yeah. Good.
I don't think there's going to be, this probably shouldn't even say this optimistically. I don't think there's going to be that big of an issue with the evictions as we're working through that right now. I don't think there's going to be a lot of response or there's been significant notice that's been given to them. Nobody's paid any rent payments there for years. So I don't think that there's a lot of support for continuing those tenancies. And there's been a lot of notice given. The court has ordered it. The Scoggie family has been very diligent in attempting to begin that process, comply with the court order. Everybody in this community knows that that place needs to be vacated and torn down. And so I think I'm optimistic that we'll have an opportunity to keep to our time schedule.
Okay, that's good. And I didn't think that the order of possession would be the issue. It was just the timing, because it's a service issue that we always bump up against.
Yeah.
Could you use the new buildings for like a dorm for the new residents to residents in? They're having trouble finding housing.
So we won't have a new building for years.
So it's down the road.
Yeah.
Gotcha.
Yeah. Unless you know a really nice donor.
I might.
Wants to kick us off with a good gift to build resiliency on the south side.
Any other comments or questions about the corner property? You're gonna help this campus in this part of town, great thing to do. So if we could get a motion to approve the action, I would appreciate it.
So moved.
Moved by Coach, second. Lionel, all in favor?
Aye.
Opposed, same sign. Hearing none, it is passed. John, what's going on with behavioral health in Yellowstone County?
What isn't going on with behavioral health in Yellowstone County? Yeah, I think the latest and greatest news is that, Commissioner Morse and I and city council and mayor, others, we've all had ad nauseum conversations and requests into the state, to Board of Investments, to DPHHS, to the administration and others to say, help us understand the impacts of the forensic facility on our local community. Help us see through some of the gaps that we've identified and how we might be able to work on them together to meet the needs of folks either here already within our justice system or elsewhere. And so we've sent the gap analysis in multiple forms to the state, to the legislature. I think where we are in this process is just a result of how broken the legislative system is, and that the Board of Investments and DPHHS take action and do the things that they do because they received a law and a signed piece of legislation that was created in the legislative process during the last session, signed into law by the governor, and now they take action. And it's very black and white. And no one within that process of lawmaking, and all the legislators that have been at the table, I think are now realizing that, well, shucks, we should have come to the community and asked about any issues that there might be as a result of us wanting to place this in eastern Montana and Yellowstone County. That didn't happen. And so the BOI sees this very black and white and clearly as a real estate transaction. And that's what they're legally obligated to do. And so that is the trigger that has been started. We have been asking for information based off of the notes and the reports we've sent up. But we are in a procurement process as far as the state is concerned. And they are not in a position to answer any of our questions until we transition into the next several phases of this project. Unfortunately for us and other communities across eastern Montana, that black and white nature of what they have to do has been put into a procurement portal that demands city or county resolution. It demands plots of land that might be available for development, information around zoning and permitting, information around utilities, etc. And the state has given the city and the county and municipalities 2 weeks in which to compile all of that information, gain public support and council or commission support via public forum and vote, and submit that information back to the state, which is completely unrealistic and impossible task for local government to accomplish. And so instead of submitting an application to this portal, which county will not be doing, the city will not be doing, but will be sending a memo and letter outlining all of our questions to be addressed. Still, the question and the opportunity remains for the state to do whatever the hell the state wants to do and put this facility wherever they want to put it. And so our goal as the Behavioral Health Facility Community Working Group has been to figure out what are the gaps, what are the opportunities, what are the things that we should start working on if this facility lands in our neighborhood and is placed here. What are all the things that are going to have to be done? And so with that in mind, we created the gap analysis as a community working group. And now we've created these priority areas for focus. And so our 4 main priorities are going to be workforce and education, pre-release planning and care coordination, step down capacity, wraparound services, and Medicaid payment and authorizations. And so we broke down into 4 distinct work groups and talked about some key considerations. You can see these in your packet. And our next meeting is November 11th. And at that meeting is action planning meeting time and saying, how can we take 3 to 5 very specific concrete actions to address some of these gap areas. And so whether they're legislative or community partnership or public-private grant opportunities, we are going to look for actual actionable steps that we can take to fill in some of these gaps and ensure that this facility, wherever it ends up being successful and sustainable. And so we've gone through this process. And I think the best thing that has come out of this process is an opportunity for our state legislators, our regional delegation, to understand that they need to come to us and ask us questions, and we can educate them. And we can do all of that in the intern session right now. And we can do all of that before we get to the 2027 session, so that we can have some better legislation created in the future and more opportunity for discussion and collaboration, instead of triggering a chain of events that just doesn't work.
What's the timeline the state's thinking as far as when they want this to be built and functional?
Built and functional is an open-ended question. I think they want to know by November 10th what areas of the state are willing to have this in their backyard and develop proposals to do that. And so that's the time. We've been given 2 weeks to say, as a city of Billings or county, put a proposal together and submit. They would like this to be built in the next year. So construction take place some point in 2026 and with an opening in 2027. That is the timeline that the legislature gave to VLI and DPHHS to get this done. And that is where we're pushing back with our local legislators and saying, guys, gals, this was not a realistic effort. We understand that there's a need and an urgency here, but we got to fill a lot of gaps and ask a lot of questions before we get to the end result. So just a background of what it is we're actually looking at. It was a small 36-bed forensic unit, a medium to low security facility. Average length of stay for those facilities is between 2 years to 5 years. These are all justice-connected individuals. They're not coming here receiving short-term treatment and then being discharged to the street. These are folks that are currently connected to the justice system in the Department of Corrections or county jails. The most frequent patients we would see would be staying there for 90 to 20 days, 90 to 120 days, as they await fitness to proceed evaluations. But they will still remain in the disposition of corrections, Warm Springs State Hospital, or the local county jail, because these folks are already in our local jails and short-term holding facilities, or they're bouncing between those facilities and the street currently. And so this facility would allow the system to have more capacity and keep folks in the system rather than back out on the street, back into the system, and back and forth.
So will it have guards to keep people in?
It's a secure facility, yes. And so it would be a secure facility. Staffing estimates now are around 70 to 80 folks, all inclusive of what's being built. So that's much more, it's a much better number to swallow than the numbers that we were originally assuming, up to about between 250 and 400 staff. But we're also getting that data based off of staffing at the state hospital, based off of staffing in Galen. And we don't have any confirmation that that staffing level is best practice or comprehensive, right? And I think we know, based on the struggles that the state hospital system has had retaining staff and staffing up, that those budgeted staff numbers might be different than a best practice staff. So those questions remain. We know that we do have confirmation that this will not be a replacement facility. That was one of the rumors. Well, we're just going to move Warm Springs to Eastern Montana and let them deal with the problems. That is not the case. If anything, this is an addition to, and it is to try to cut down on the amount of time that folks have to spend driving between Billings and Warm Springs and transporting patients back and forth. And so with the addition of this facility, it'll cut down on that travel time. It won't mean that folks from Missoula and Flathead are coming to Billings and vice versa. There will now be an eastern and a western facility to maintain capacity. So there are a lot of questions remain, a lot of issues out there. I don't see a quick resolution to any of this. And I'm hopeful that in the next phase of this procurement process, the state comes back to Billings and Yellowstone County and is willing to answer some of our questions. But right now there's a motion at City Council and a motion at our county commissioners level. And those are the two governmental bodies that would need to apply in this portal by November 10th. And both parties have declined to do so at this time because we don't have all the information. It's essentially like saying, yes, I'll put a down payment on that vehicle, but I haven't test driven it and I haven't done any research on it to know if it's going to be good for me and my family. What they're asking of us is not feasible in the eyes of our local government.
Hey, John,
Hey,
question for you on not familiar with the bill that authorized this, but if it is not built by a specific time or identified by a specific time, do those funds based on the statute go away, or are they within the statute they're permanent? So it could take 4 years to do it, and at that time the state has the legislature had authorized the dollar. So is there a deadline within the statute that if this isn't done, that it's void, I guess, for all intents and purposes?
This money will roll over from biennium to biennium, and so they don't want to get in a situation where they're doing that, but there's nothing in the statute that I am aware of. And I think John S. was one of the authors of the statute, and he's told us that this is rollover money. So
Okay.
if it isn't done this year, the funding will still be there to get this done.
Okay. I guess the other question would be, as the city county looks at this, I'm assuming these dollars then come out of to fund day-to-day operations, are coming out of the Department of Corrections. And I don't know, but I'll make that assumption. And so I guess the question would be, as we go down and as we've seen budget shortfalls, people start cutting things. And, I guess the question is the assurances that this would be staffed properly. You alluded to it, staffed properly, financed properly, and those items that are necessary to run a facility like this in I'll call it first class manner versus we'll just cut it and let it get by. Because that would be the concern as a resident of this community is, okay, they start out well, but like everything else, things seem to get cut, and problems exist or are created. Just a thought.
Thanks.
And should it be built? I'm a little confused. Should it be built? What responsibilities would RiverStone Health have afterwards?
None.
No,
Not for this facility.
we're participating in the.
Our ability to bring people together is why we're in the middle of this conversation, because it's a public health need to address behavioral health issues. It's a public health need to make sure that the folks that are currently on the street with severe mental illness get into some sort of treatment or system so that they can recover and rehabilitate. And that's our goal at the end of this. So we will continue to help be co-facilitators of the behavioral health community working group, to ask the questions of the state, to facilitate the conversations, to answer questions of our local leaders and that. But it's not our facility. It's not our responsibility. It's an opportunity for us to make a difference. And that's what we're trying to do.
Good to participate in such a high level.
So where do they find the professionals who help these people? I would think there are not too many around.
There aren't. So that's one of the issues. That's why workforce is the main topic, is we know that if and when this facility is built, we will see brain drain from ourselves, from the hospitals, from Rimrock, from New Day, from all the other organizations around the region currently providing services. And that's part of the issue, is how do we invest some money into building workforce, into making Billings and marketing Billings as a great place to work and make a difference, and attract that talent that is wanting to participate in this process. So more questions.
Do you get the sense that there's support or interest to even come to the table? I guess more from a personal and professional. I've been disappointed in sort of the not in my backyard resistance, because I do see, while I understand there's challenges, this is a public safety issue. This is a public health issue. I think it's important that we at least come to the table. Do you get a sense from these meetings if there's any interest in working, or are we still at the we're not doing this phase?
No, I think I would let Mark speak for himself, but I think we've moved, at least in our community, from a stance of hard, firm resistance to a soft acceptance and soft support, even in some cases, of we need this in our state. We need this in our region. But we can't have it unless we have that is point F, and we need A, B, C, D, E filled and fixed before we get to point F. Otherwise, the whole system's going to crack continuous. So I've been pleased to see, even at kind of commissioner level, city council level, our local regional legislative level, and the behavioral health community kind of come together and say, yes, we can, but if, yeah.
Okay, good. That's encouraging.
Yeah.
Sounds like the patient population for Deer Lodge and the new facility different.
Yes.
The more long-term patients would be at Deer Lodge, and the shorter term patients in a new facility?
It depends. It's a different population because not everybody in Warm Springs is justice connected and within the justice system, where everybody in this facility would be justice connected.
Okay.
Yeah. And so it's a different population. This population is more what is currently in Galen, the Galen facility.
Okay.
In jails.
Yes, or in our jails. Yes.
And John, you were talking a while ago about saving people driving. So are they gonna limit the population here to those who have nearby family? That way beyond.
That's theoretically the goal, is to say this will be the Eastern Montana facility and this will be the Western Montana facility, and let's not go over the big rock in the middle anymore. And so the population in Warm Springs is majority driven out of Missoula County and the Flathead region. And so there's a need to say, how do we decompress and put something out here in the east that can handle the demand that we have?
Question for Steve or John. Is the business community behind this? Chamber of Commerce and business community?
I don't know.
Okay.
Dennis, I can tell you, I don't think there's been a lot of discussion because of a lot of the questions that John has alluded to already is location, how it's funded. You know, it's sort of like, you know, if I use the expression, if it's state of the art and really advances what's going on, then I think the business community, depending on where if it's located in downtown Billings, I'll tell you they'd be diametrically opposed to it. So location plays a big part in where this is. So sort of mixed, I would tell you right at this particular time.
Yeah.
Thanks, Steve.
And there is I will be going to a Chamber of Commerce event with business leaders on next month on the 18th. We're going to tour the new short-term holding facility and talk about jail capacity issues. I told them I want to talk about behavioral health and prevention issues and how they're all interrelated. So I think we'll have that conversation, but quite frankly, it's been more about the urgent need to come together as providers, because the providers know that if this thing comes to town without certain answers or guarantees, that our whole provider network and system will collapse under the weight of it. And so we want to make sure that that doesn't happen.
Other comments? Big challenge.
Huge.
We have plenty of time for a roundtable. And Steve, any comments about this morning's meeting?
My biggest comment, or it's not a comment, is hats off to Spencer and to Shanna for the first draft of the KPIs and the staff. Just looking at it without really going into it in depth, I will tell you, I think it's setting a different precedence of moving forward. So congratulations on the work in the finance committee in moving forward with it. So thank you.
Brent, any thoughts?
No, thank you. Enjoyed the meeting.
Would you enjoy the governance committee meeting right after the vote? Be able to participate till about 10:15?
I can go till 9.
Okay. Brent, can you participate till 9?
Yes, yes.
All righty. Michael and Coach? Okay, we'll do it. Michael, any thoughts about this morning?
No comment.
Michael?
Just on the KPIs, I thought that the background trending graphs are just great. Got the number, and then you have the thing in the background that sort of gives you perspective. and all that. Otherwise, it's
Coach?
I've just been thinking that in the evaluations we have of each meeting, we might get more responses if John were to address the responses we get so that people know that's a way they have of bringing things up.
That's the only question I got last month, so I don't know, I didn't know how to.
That was me, of course.
Debbie, any thoughts?
No, I would agree with the graphs and what wanting to look at it this way. So that was a great win for me. I'm learning about the gap analysis. That was very interesting. There's a lot of information out in the public that was like coincide with that. So that's good information to pass on to other people.
Okay.
Other than that, yeah, that looks good.
Aaron?
I would agree. I appreciate the information on the gap analysis and the work being done. It's encouraging to hear that there's some conversations around it and hopefully some positive movement, because I think it is something that our state and our community needs. So thank you for having that.
I just, my main comment is on the Colonial building. I mean, that's a remarkable achievement that we can buy that building and put and destroy it or take it down and remove that. I mean, I think from a staffing perspective, it's a security issue. Just a visual perspective, it's removes the light. So yeah, just really congratulations and appreciate. I mean, I know that's been a lot of effort over a lot of years, so I appreciate you guys having the finish that.
It's gonna be more effort to come, and we'll celebrate once we get to the finish line. And lots of hard choices and hard decisions that have to be made for that place, but we've got to do it.
For the right reasons.
Yeah.
It'll be very good to take that down, get to that point.
Jim, any comment?
Nope, have no other comments, Coach. And with that, we are adjourned.